So another major issue here is access to healthcare, especially at the Pontiac Hospital. So please outline your vision. How do you improve access and quality of healthcare offered in Pontiac? And I'll start with Terrence.
Perfect. I'll say it before my
I'm getting used to it.
Actually, you called me yesterday and I was not even there. He told, in my introduction speech, I thought about the private hospital in Charleville. Let me be objective here. What if the hospital in Charleville is private and it must deserve everyone that lives in Pontiac? And it gets new, I would say, customer, because now they're not sick people anymore. They're customers to the hospital, and it will bring new customers from Gatineau, from Ottawa, from all the other space. What if that project is on the table? I think this project is viable. This project does exist somewhere else in the world, and I'm pretty sure it will find the buyers on the private sectors. The Charleville Hospital could be private, could deserve with the RAMQ all the citizens of Pontiac and get new customers from Ottawa, from Gatineau, and from the other place. Why? Because it will be faster, better condition. I think it will grow over there.
Okay. I'll move on to Will. Just at the start, maybe keep it with your own vision, and then we can have a conversation.
Yeah. So we're completely against privatization. I think the creeping of privatization to our healthcare has slowly degraded our public efforts, public work efforts, and such. Our public healthcare systems. We're going to be getting rid of Bill 10. We're going to make sure that small regional councils can come back on boards that can actually tell us what they need. We're also going to get rid of the PREM, the Plan Spéciaux d'Effectifs Médicaux. Yes, that's it. We want to ensure that there's going to be an actual arrangement of health professionals in the region, so there's not like awkward clumps of individuals in different cities. We're going to ensure that resources are actually moved to smaller regions such as rural areas and the Pontiac. So that's what we're doing.
For the Pontiac, for a rural region like the Pontiac, I can answer that we think that we need to, first of all, decentralize healthcare. For a lot of years under the Liberal Party, under the CAQ, there's been a lot of, first of all, austerity, then inaction. What we need to do is finance our public health system and decentralize it so we can have local clinics, proximity clinics, so that everybody in the Pontiac can have access to health services on their first line and not rely on only doctors and emergency care, but can see a health professional quickly and efficiently. That's why we're going to invest up to $500 million a year into a network of local clinics. That's why we're going to invest $1.5 billion a year into bettering work conditions, because we know that bettering our public health system, especially here in the region with the proximity of Ontario, is by bettering work conditions, by bettering salaries, and we need to put resources towards that. And we also need to revisit some administrative issues like the temps supplémentaire obligatoire. And what we want to do is eliminate that and put in place a self-governance schedule for professionals on the field, so they can have some autonomy in their workplace. Privatization is not on the table for us. We're actually going to reinvest in our public health system that has been put to the side by previous governments.
There's a crisis in the healthcare system in the Pontiac and in the Outaouais right now. It is at a level that it has never been before. There are currently at the Pontiac Hospital 17% of nursing positions that are staffed in the care unit. If you look at the Gatineau Hospital, it's 35% of the operating block, where people from across the region go to get their surgeries. Obstetrics is still closed here. Emergency room in Gatineau closed last year for the entire summer. The surgeries are backed up, and the delays are getting longer and longer and longer. And all of this is because we are short-staffed, because we don't have enough healthcare professionals in our network. The first thing we need to do is look at the regional difference here in the Outaouais, find a regional solution, and we put one on the table during this campaign. The Liberal Party put one, and that is to say we need equal pay for our healthcare professionals as Ontario. It's not a measure for Montreal, it's not a measure for Quebec City or for Saguenay, but if we don't do that here, we will keep losing our nurses, we'll keep losing our mental health professionals, we'll keep losing our social workers to Ottawa, to Brantford, to Pembroke. The only way to dig us out of this situation right now, or to stop digging and to fix the situation right now, is to pay our healthcare professionals the exact same amount. Doesn't mean you don't work on working conditions generally. You do need, at some point, better ratios on patient versus personnel. It does mean you need to stop forced overtime in some parts, which generally, thankfully, we've been managing to avoid for the most part here in the Pontiac. But it's an issue, it's a real issue that needs to be resolved. And if you don't fix the pay issue, you'll never have enough staff to fix the ratio issue. And if you don't fix the ratio issue, you'll never be able to fix the forced overtime issue. It starts with paying our healthcare professionals equal salary. That means, and it's in our platform, $25,000 more in salary per nurse that is currently working in the Pontiac and Louisville.
Okay, the Green Party of Quebec, I mean, the budget for the healthcare system is about $54 billion, right, for this fiscal year, which is a lot of money. So what we believe here is that we should be able to supply good service with that amount of investment in the system as it is right now. What we need to do is to do kind of a large audit of the health system, you know, look at everything, what are the resources, where do we lack resources, where in which region, you know, we need to, you know, put a bit more effective, decentralize, you know, bring the decision back in the Outaouais for the Outaouais region, in the Pontiac, you know, like the idea of building this new hospital in Gatineau, you know, it's going to be there in 10 years. We're having issues, you know, supplying 300 nurses right now, for 300 beds right now, the hospital, to have the staff. Now we're going to double that, you know. It's just, and not just that, now you rely only in one hospital, like we had issue like in Montreal, or is it I can't remember the name of the hospital, with the mushroom, you know, like the new, it just started like, so I mean, if you have that in one big hospital, you're stuck, you know. They should invest more in Charleville. Don't close Wakefield, make it a bit bigger and renovate all, you know, I mean, so that these questions, these decisions, we have professionals working in the system. They can figure that out, you know, and we need to stop to just emergency, you know, put millions there, because we're just fixing something that's broken. That's so decentralization, privatization, not at all, unless it's recommended by the committee, you know, for, let's say, for you need a blood sample, stuff like that. You know, there's a few things that we might be able to do, and it's going to be an advantage to the system. And we need to manage, like you said, like we need the particular status for Outaouais. We need that. We need to increase the salary, and that's about the key things for the Green Party.
Let's open it up.
I'm going to start by addressing the empty chair over here.
Yeah.
Maybe somebody can tell me why in the world the governing party thinks it's a good idea to close the Wakefield Hospital. I'm not surprised that the empty chair is giving me no answer right now, but that is what the CAQ is proposing.
I've looked into the clinic plan for the region of Outaouais of the CAQ, and it's not only closing the Wakefield Hospital, but it's changing everything we do around healthcare. They want to centralize it even more, remove services in certain key regions like Buckingham, but also in Wakefield and Charleville. That's going to be people that are going to lack proximity health services. That's incredibly dangerous, and I'm not even surprised they're not here to defend that record, because it's undefendable.
Don't get me wrong, they will close Charleville as well. It will take 10 years.
Yeah, but so will you.
So will you?
No, you're proposing a private hospital because you'll be able to attract people from Gatineau. Do you know who is at the emergency room right now in Charleville?
No.
50% of the people there are Elmer residents.
Yeah.
It's already Gatineau
Don't-
people
yeah.
who come here. Privatizing a rural hospital does not work. It is not a moneymaker. It has never been and never will be.
that's up to
and it's
your
okay.
opinion,
That's a government decision to invest and give healthcare services to rural areas, and that is the right of every Quebecer. But if you privatize a rural hospital, it is just about, and I'll say it again, Mr. Waters, the worst and most detrimental idea that anybody has put forward in this campaign, in this riding or in any other riding in the province.
That's in your opinion, that's not in mine. I think the system right now is broken. Pierre, you said it yourself. You cannot fix something that is broken. It has to be changing. If it's not changing now, it will change in 4 years or in 10 years. You will see. Everybody knows it.
But we-
Sweden did it 12 years ago.
we need to do a proper study with all the minister, all the professional working. If at the end of the day, you know, they're open to that and there's a portion of the system, it's an advantage because we lack staff to do the most important task, then I'm open to that. But I mean, to go straight from the start to that, for me, it's like the worst idea you can have. What people need, you know what's the first thing to do? It's right now, what are we doing for the pregnant woman? What are we doing with people that have serious healthcare issue in the Pontiac? We need to find solutions for these people while we're trying to manage the whole big system. What we need to do in this writing is to take care of the people now, So we need to fix the system so they can have access to their service and the treatment they need, to go back to their
In
health.
care right now, it's all about working condition. You said it yourself, gentlemen, it's working condition.
We all agree on that.
Temps supplémentaires obligatoires.
But
It should not be-
privatization will not better work condition. If
That's
it
up
would
to your
better
opinion.
work
That's up
condition,
to
we
your
would
opinion.
already
I'm a
know it. In
businessman.
Quebec
I
healthcare system right now,
That's
it's
in
never been
your
as
opinion.
privatized
That's-
since
no,
the
no.
implementation of
That's
the
your
private
opinion.
of the public healthcare system in Quebec. We at the moment right now today in 2022, there's never been as much privatization.
Okay, let's open
in
it.
Quebec.
Your
How can
party,
you think
Quebec
that it's going
Solidaire,
to fix it?
wants a Quebec farmer.
Yeah.
Have you been to pharmacy lately? I've been yesterday. Service is great. It is private. I've met 3 pharmacists.
Pharma Quebec isn't about privatizing pharmacies. It's about making an institution that is going to work on reducing drug prices because
No,
right
no,
now
no,
we're
it's
paying,
about-
we're
it's
paying
about-
billions of dollars as
No,
Quebec
no,
nation
no, I've
into
read-
buying
I've
drug
read the-
prices from international companies.
Right now.
We're going to put in place Pharma Quebec. That's going to save billions for the Quebec
No, I
for
disagree.
Quebec because it's going to make it so we can make our own drugs. We can do our own research. We can make generic drugs
That's
that we're
not-
going to
that's
sell
not
by
all
ourselves.
over-
That's going to reduce prices, and a lot of specialists in the question have done research. The NDP has also proposed that, and the CAQ has looked into it during the pandemic because during a crisis, we don't always have the ability to rely on international cooperation because we've seen what happened during the pandemic. Everybody closes down. Pharma Quebec is an idea, but it's not about private nationalizing pharmacies.
It is. I've read it.
Mr. Waters and Mr. Sebanganzi are getting pretty far away from the topic here, which is how do we improve care at the Charleville Hospital and across the Pontiac. There are things we can put on the table right now that can, in very short order, help to at least stabilize the situation and improve the situation. I'll say it again, we need to pay our healthcare staff better. That's why we're putting $25,000 extra per nurse to make sure their salary is the same as Ontario. What else can we do? Can we have a daycare that is only provided for healthcare workers? Right now, there are healthcare workers who are staying at home because they don't have a daycare for their kid in the Pontiac. That is unacceptable. That cannot continue.
I'm glad you're
Can we talk to the governing party whose motto in this campaign is continuons? It's not let's continue because they won't translate it.
Let's start.
Let's continue what? Let's continue giving half-baked services. So please correct that on the record. Let's continue giving improper services. Let's continue having 17% staff at the Charleville Care Unit. Let's continue with premiums instead of increasing salary, which clearly are not bringing back any healthcare professionals. Mr. Waters has the worst idea on the table in terms of healthcare, but just continuing to do what we're doing is the second worst.
But the thing I find interesting is that you're saying that, Mr. Fortin, but your record has been, you've been in the cabinet with Mr. Couillard, working with Gaétan Barrette into centralizing our healthcare system and cutting into it. The austerity under the Liberal government is the reason why our healthcare system, especially here in Pontiac, is so broken. Right now, the CQ hasn't done a lot to fix it, but they're working badly on fixing the mistakes of your party.
They're working on closing the Wakefield Hospital.
That's
They are
true.
working on taking away services
about your
and
record?
naming services and taking them away.
And-
we can talk about 2014 and 2018. Well, you should have ran in 2018 if you want to talk about that.
And-
We're running next.
I was just gonna say, I wasn't old enough to run in 2018, so I couldn't even have like.
But Mr. Fortin, I have to agree with Mike Owen. I mean, the CAC is not doing a great job, but I don't think that your party did a great job either. So, but that's not personal.
We're all here, but we're all running in 2022 to
Exactly.
say
Yeah.
what we
Let's
want to
move
do
forward.
to improve
Now,
the system.
we have to
But how
move
can you trust your party to do better when you're the reason why not you personally, but your party is the reason why the healthcare system right now is so underfinanced?
It is not
It
It is not underfinanced.
How can you trust your party into fixing things when you're
It's
broken?
not
the
under
system?
finance. It's not well structured and organized.
Yeah, so that's an interesting point. Is it underfinanced? Like,
Well, in Ottawa, although
Yeah, in
saying there's
Ottawa,
a $600
ratio-
million, $600 million deficit
Yeah,
into
in
healthcare
Ottawa,
system.
you're right.
So-
I agree with you.
Okay, 600 million. The Odo says 308 million. So just to correct your number, it is.
Maybe-
But it's not.
maybe
It's
I
not
didn't
great.
know.
It's
It's not great.
it's
It's
a
still
bad
not great.
number. It went from $250 million in 2018 to 308. So between the time that the CAQ voted a motion to say, "Hey, we're underfunded," they let that funding gap grow even more. Just the idea of nurses that we're putting on the table is
That's a
$62
great
million
idea.
this year.
That's a
That
great
is
idea.
$62 million for one type of healthcare
And we're going to do
professional.
more than that.
The other
because
thing
we're
we
putting
need to
more
do,
money on the table.
and we could talk, if you want to talk about our record, one of the things that we did do is open the McGill Satellite Faculty at the Gatineau Hospital. That is something that we did do and something we need to build upon even more.
That's great.
The one thing they don't do is graduate enough people. We need to increase the class sizes at that faculty so that we can have more doctors in the region
That's
and
true,
people
but
can have
that's
additional
again
services.
focusing on doctors in
Well,
providing
I'm not willing to
services.
ignore it. You cannot ignore it. We could talk about other healthcare professionals.
Yeah,
That's what we
because-
just did. But we also have to talk about doctors because people do expect to have a family doctor.
That's true. We need doctors, but at Quebec Solidaire, we judge that other professionals have the competency to give out health services, and that's why we're going to delegate the power so they can give out services in local clinics. Because right now, the previous governments have always talked about one doctor per family, one doctor per family, one doctor per family. Right now, the system isn't ready for that. We need to restructure it and then move to one doctor per family. It's a long-term plan, but short-term salaries, I agree with you on that. But right now, it's not only nurses, it's only other healthcare professionals that need to see their salaries augment.
The citizens, like I went this week to see a doctor. The system, I managed to see a doctor within 48 hours in the Pontiac, right? So that's the way to go. To try to have, everybody has their own doctors, it won't work for like the next 5, if not 10 years. So we need to find like the temporary solution that they have in place in Pontiac right now. It worked for me this week. So that's what we need to do, right? I mean, we won't get the doctors out of the school for at least 5 years, if not 10, right? That's just the way. And then the competition kicks in from the United States, from Ontario. Then we lose, the experienced people because they get more money outside. So it's a bit of an illusion to think that in the short term we're going to have a doctor per person.
I think it is doable, and I have to agree with Mr. Fortin here. Every family needs a doctor. Of course, we give more power to the nurses, to the pharmacists. It's been done for the last 15 years. That's different. They can do prescription right now. For a few examples, they just can do prescription for new drugs.
So doctors go
But-
to nurses so they can write documents for them, and then the doctor signs on it. That's a waste of time. And a waste of
Exactly, you
money.
got it. You got it right here. That's why we can do it. The doctor's charge is 30% paperwork. That 30% can be done with someone else. Working right now either at the government, that could be working as the assistant of the doctors and doing that 30% of the job. So the doctors could focus on the clients.
I'm glad we agree, Mr. Waters. That's
Nobody's
pretty rare.
I don't think.
we got one more minute. You want to add anything more?
No, I think I covered most of the things in my intro. We're gonna rework the system. We're gonna make sure that nurses and medical professionals have good sick pay as well. We're gonna make sure that we're gonna make sure that we have competitive pay with Ontario. We really need to make sure people can stay here, as well as we do want to sign on to the Pan-Canadian billing system for doctors. We're going to make it easier, less paperwork for them, less paperwork for everyone in the end. And we're going to remove Bill 10. We're going to make sure that we can hear from the institutes from themselves what they need so we could better aid them in that.
Okay. And last 30 seconds, anyone want to jump in?
The issue of family doctors is one that any Pontiacer, if you knock on a Pontiacer's door today and they don't have a family doctor, they want one. They want one. It is not something that we can say, hey, we're not going to get there, therefore we're not going to try. You have to try to give people a family doctor. It's the first responsibility and expectation of citizens.
Okay. That's it.